you.
Thank you very much. Good morning, everybody, or good afternoon, everybody. Now it's afternoon time. I'm just pulling up the screen. I hope you can all see this, our first slide. Indeed. Thank you. Thank you for having us here today, indeed, to present to you what we did over lockdown, which seems so far long ago now, but actually we're still in lockdown and we're still supporting and helping our WhatsApp groups. I myself have a nursing background, like Claire before you. 30 years ago, I was a nurse and midwife, so I come to this with a lot of energy, hopefully, to make those changes and to be proactive is our motto in approachable parenting, not reactive. So we're hoping that, like the action you're talking about this morning, that we continue this action as well. So this was a time of uncertainty. If you go back to March 17th, when we came into lockdown, very much time of uncertainty. What was happening? What was going on? Nobody seemed to know what was the communities, especially our ethnic minority communities that we had lots of connections with, were very unsure of what effects did lockdown have on them, and becoming very, very anxious. And we want to share here this morning our experience of how we engaged with them over this period of time. And we may talk a little bit fast, Joe and myself, because we both have actually an Irish background. So although we haven't kissed the Blarney Stone, we do tend to talk quite fast. Just moving on, I'll give you a little bit of background about approachable parenting first. Approachable parenting delivers evidence-based parenting programs from pregnancy right up to parents of teenagers. So we have pregnancy and beyond, pregnancies 3, 4 to 11, and teenage programs. They are recognized by Department of Education. We were recognized in 2011. We received the Can Parenting Quality Mark in the House of Commons, along with the Solihull Approach and Family Links, which was a great privilege in 2014. And we are also on the Early Intervention Guidebook. As well as delivering parenting programs, we train up trainers to deliver those programs, and all our trainers get a teaching qualification as part of that. We then train parents who come on our programs to peer mentor other programs, and we call them sparklers because this originated from Sparkbrook, and they are really our sparklers. They do shine and glow and help parents so much, either on our WhatsApp groups or on a one-to-one basis. And also, we do have a history of working with the midwives, working with Jo and the team, her home birth team, where we were hosting over more than a year, I think it was nearly 2 years, the home birth team coming into our organization to meet parents and to share experiences of home birth. So that's kind of a little bit of background. As well as that, I do host a weekly Unity FM show. It's called Parenting Hour. It goes out in the West Midlands as well as down south in Luton and Milton Keynes, with a lot of listeners. And Jo is one of our wonderful guests that comes regularly on, promotes active parenting, our pregnancy and postnatal, how we can look after ourselves, as well as home birth. So it's really wonderful there. And she brings some of our parents that have actually gone through the experience of home birth as well, mums and dads, to share that. So that's been wonderful having those links with Jo over many years. If you do want to find out more about approachable parenting and what we do, please do visit the International Journal of Birth and Parenting Education, because we actually have done a publication there recently, and all information is there. So just giving you a little bit of flow of how we formed these groups. Approachable parenting, our journey is really based on the 3 R's, where we have the relationship, the resources, and relevance. Our relationship with our parents, we came in with 100 lockdown groups already, 100 lockdown WhatsApp groups already in lockdown. And these were from over the years where all our parents that were on programs were already in a WhatsApp group, and it worked very well. So we were able to communicate with them very well. But also on top of that, starting from just after the 17th of March, doing lively Facebook sessions to ask parents, what are the issues? What are your concerns? We want to listen to you. We want to know, we want to be able to respond to you. What's going on there? And we were flooded. We were flooded with issues, flooded with concerns. I remember talking to the team thinking, what are we going to do with this? And then the idea came, let's start up an antenatal, and later on it was a postnatal WhatsApp group we set up as well. Within 2 hours of setting up our antenatal group, we had 60 mums, pregnant mums, join us. So that will just give you the worries, the concerns, the issues. And as you mentioned this morning, everything was changing. If you remember back those days, everything was changing, the uncertainty. Nobody knew what was happening. And minute by minute, it was practically changing. We contacted Jo from our wonderful relationship with Jo, and we actually asked her about the issues that was happening. And Jo was able to get back to us immediately with proper answers to share with our parents at that stage. And later she joined actually the groups, which she'll tell us more about later on. After that, we also put on in different languages snippets of information, informing people about other resources such as Baby Buddy app, because we do a lot of work and we love Baby Buddy app. And we thought, how can we get the information out there? So we were doing this initially with no funding, but later on funding did come, and we managed to open even other WhatsApp groups through the See Here Respond and our partnership with Barnados, which we've reached over 3,000 parents in the last 6 months. What else did we have? We have resources, we have our relationships, and we knew we were relevant. With this, our approach was underpinned by the community of practice, and I'm sure a lot of you know about Wanger's approach, Wanger's model, a model that brings together people of common concerns, that shares a set of problems, that have a passion about making a difference, making a change. And this is what we felt we were doing. We wanted that strength-based approach, and this was the approach that underpinned our modeling moving forward. This is the ethnicities of the groups that we've had, our postnatal and antenatal groups combined together. We really do reach the hard to hear, the hard to reach communities, the ethnic minority communities that are there. And we are still today, even now, the phone is dinging with messages going through and for. And I'm going to pass over to Jo, who's going to describe this more about how the process and how we continue today to work together.
Thank you, Kathleen. That's wonderful. Lovely to have your introduction and to set the scene with approachable parenting. I'd just like to say to everybody, just as a start, Ramadan Mubarak. We're in Ramadan. Our WhatsApp groups are all the women on there. A lot of them are fasting. So a lot of the chat at the moment is about fasting and pregnancy and how they're managing. This slide here is just gives a little summary about timeline dates. And there's a lot of anniversaries for everybody, isn't there, at the moment? A lot of anniversaries of the confusion, the fears, the loss of family members and colleagues that happened through this last year. So much has happened. So much has changed in a year. So much more needs to change. A crisis is an opportunity to do things differently. No more so than the COVID crisis. Actually, I would say that issues which have come up to the fore over this past year pre-existed COVID. COVID and lockdown have been the tipping points for triggering already necessary change. Women from BAME communities navigating maternity services have been falling through the cracks in maternity services for some time. And Embrace evidence this, and the 5 Times More campaign is continuing to push for answers and action. I don't know if you can see me on the screen. Am I being shared as well? But this, I was here last year holding up my hand for the 5 Times More selfie, as I received an award actually from the festival. I was really pleased. I was making my transition into more digital virtual work, and this has really blossomed in this year, as I'm telling you about. Through the period March to June 2020, our local Birmingham statistics really showed the steep drop-off in attendance by people from the BME communities. And I know that term's really awkward. We need to find a good one, whatever we call the diverse communities, not white communities, at local paediatric emergency department and triage, as confidence in services plummeted. In early April 2020, Chief Midwife Jacqueline Dunkley-Bent put out the call to BME midwives, nurses and MSWs to join a webinar about the impact of COVID on BME staff and patients, and her concern about how to reach local women. And a group I was connecting with, that both Kathleen and I were part of BME and white ally midwives, doulas, MSWs, children's centre outreach workers, all working with local women from South Birmingham. We responded. we named intersectional racism and Islamophobia as important underpinning causes of health and mortality disparities. Racism was not much named at this time. Serious inclusion, diversity and equality work had yet to get underway, which it thankfully has done through this year. George Floyd was still alive. BLM had yet to take to the streets. 31st of March, and I've just featured this quote here in the middle of the slide, one of our group put out the call for help. She said, there are so many stories going around, fears are rocketing amongst the women who they were in touch with. This is through approachable parenting. It didn't take us long to launch our Expecting Mums WhatsApp group, 16th of April. We already, as Kathleen's been describing, she had the experience of WhatsApp group work, and we then, myself and colleagues, had clinical skills we were able to bring. So we already had a working relationship of collaboration, not working in a silo, working across between the maternity trust and then the local parenting group, and a sister, needless to say, a sister postnatal WhatsApp group quickly followed. So the next slide I just want to talk to. Really, I want to introduce a wonderful video that we have made, which is going to round off our presentation. We've co-produced this video with participants from the WhatsApp group, with Monica, Marine, Liz, Mariam, and Samiha, and Angela, the midwife in the video who introduces it. She and I trained together 30 years ago. We're both still working at the Birmingham Women's. She does bank work in the NIPE clinic, I with the home birth team. And Anna Met is the physio who works with approachable parenting, also doing nutrition advice. And she's also working, actually convening or adminning the groups a lot. We'll show the video in a moment, but briefly, I want to pick out some of the themes touched on the video that have distinguished the experience of participating in the groups and the weekly Zoom workshops that we established. I've just put this under a slide heading of C's and S's. Kathleen did ours, but it just helps to remember the issues that are important here, I think. And I want to say about communication is two-way. It's not one way. It really is a chat, a dynamic conversation on the WhatsApp groups. It's not just sending information out to the communities, it's receiving it back. Traffic on the groups can be heavy. Sometimes I check my phone after an hour and there are over 100 messages. And, you know, these messages, it's not sort of, I have to engage with every single message. The women are responding to their own messages and I just sort of nudge it here, nudge it there, clarify it, whatever. So other times it's quiet. And then someone asks, how are you, Messina? Because maybe she had issues yesterday, and off goes the chat again, which is brilliant. And, you know, we hear all about everything. So early on, I discussed my involvement with the groups with our trust consultant midwife and our head of midwifery to put them in the picture and check I had their support. And mostly from the women are from Birmingham. Women are booked at diverse maternity units across the LMS, but they're also coming from beyond Birmingham, from Guildford, from Cardiff, from Sheffield, from Barking, and that's because of the reach of the approachable parenting work. So we're nurturing a culture of supporting clinical choices. Women used to, in the early parts of the group, ask, am I allowed to do this or that? And their questions aren't phrased like that so much anymore. The prevailing culture is now one of choice, which is brilliant. And sometimes that choice can be facilitated by a referral to the consultant midwife or to the PALS team to debrief a previous traumatic birth experience. Many women have high risk aspects to their care. They have diabetes or raised BMI, previous section. The majority, as you've seen in our demographic slide, are South Asian, who are 2 times more likely to die in terms of the analysis, the study of the embrace statistics. But then we also have a number of women who from the Black community, Black Caribbean and Black African, who have this 5 times more dreadful statistic connected with them. So we've got intersectionality as well then with these women, majority being Muslim. So I won't go into much more detail about with the slide. You'll hear about from the women in a moment in the video. But just to say about connecting communities within, women to women, and then also with professionals, we try and create a comfortable, culturally, my C's, culturally inclusive and nurturing space. That's been so important. And the psychoanalytic concept of containment, I think, is relevant here. Professionals and the approachable parenting team admins provide secure boundaries and emotional holding. If someone shares something upsetting, then one of us moves in to offer to direct or private message them to gather them up, so it doesn't sort of overflow into the whole chat, and just contains that, and then we can move along. The complementary concept of reciprocity reflects the conversational dance of mutual support and interweaving flow that we have in the groups. I think so beautiful. I think these groups are replicable. I think we've done this with this group of particular community, but I think very much it's a replicable model and really reaches women. I was talking to a colleague in the home birth team. I think we're going to try and set this up with women who are currently booked with the Birmingham Women's Home Birth team, so they can connect. We've learned as we've been going along, we've learned how to keep the groups safe, secure from being bombed with offensive material, which I'm afraid we did have in the beginning, which was awful, but we've dealt with that, and the women managed and coped with it really well. And now joining is via an Eventbrite link, which also gives us the chance to collect and monitor demographic details. At first, we ran the group 24/7. Now we close around 9 p.m. and reopen at 9 a.m. Anyone from the team with admin status can open or close the groups. For safety, we've needed to establish clearly that we're not an alternative to triage, nor are we an emergency service. Being clear about when to call 999, 111 or triage. We've picked up undisclosed safeguarding issues, which we've been able to signpost onwards. We signpost a lot for mental health support to the infant feeding team, breastfeeding counsellors. As most of the women on the group, and I'm nearly finished because we need time for our video, sharing the experience of being Muslim, specific cultural and religious interests are discussed. And then women offer prayers, dua, when someone's having a difficult, hard or sad time, or offer blessing and prayers and congratulations when babies are born. And where our last slide at the end of the video you'll see is this wonderful blessing, which I had never heard of before, but it's about when your baby's born, they say, may your baby be the coolness, and that's my last C, of your eyes, which I think is beautiful. So enough from me, and let's hear from the women and from the group's video.
Okay.
My name is Angela. I've been a midwife for over 27 years, and I'm currently working as a bank midwife at Birmingham Women's Hospital. This has been a unique experience for me, providing support via WhatsApp groups and Zoom sessions to see the women initially very afraid and unaware of what the services that are available within maternity. And sometimes they had very low confidence at the beginning, but to see them grow and blossom and then go on to support other women and other mothers.
I got pregnant. When I found out I'm pregnant, it was the very beginning of COVID. I was very worried, I was very scared. I couldn't see my GP. I do suffer from anxiety as well. So I couldn't access any help. Kathleen, I believe it was Kathleen who told me about the group, WhatsApp group, which I joined not having really much expectations of it, because what can you get really over WhatsApp? Not much. I was very worried. I was very, very scared. I couldn't, I felt nobody was listening to what I wanted to say. Nobody cared about the experience I wanted to have when it comes to labor. I have to say, I don't know what I would have done without the group. It was a great initiative, and I'm glad I knew about it and I could join, because I don't know what I would have done. I was feeling really overwhelmed by everything that's happening in the world. And in this kind of time, to be pregnant again and have to go through the hospital appointments all by yourself without the husband next to you. Trying to think who you're going to leave your kids with to go to the appointment when you can't see your family. It was scary. But we went through it thanks to the group. And I have to say, I had the better labor than I had before. Everything was much better. My experience in the hospital was much more pleasant. And I have to say, this is thanks to the group. I would never expect this from a WhatsApp group. I just want to say thank you, ladies. I feel very emotional. You have helped me a lot. I'm so glad.
Yeah, really, the group was just there for support. I think what I loved the most was that, any time in the day, if I had any question, no matter how small, no matter how big, I'd get responses from at least 10 different people offering me somewhere between personal anecdotes for the other mothers in the group to professional medical advice from the midwives. There was also a physiotherapist in the group. So when I had some back problems as a result of a slip disc, I was able to get instant support. Really, what was the most important thing for me, especially with lockdown, is the fact that I knew that I had somebody there to talk to. I never met any of these women. I've still never met any of these women in real life, but they feel like friends. They were my support network. The approachable parenting staff and the other mothers in the group were there for me in a way that my friends and family just couldn't be. It's so funny because I remember there was one woman in the group and we were literally video chatting her as part of the Wednesday meetings while she was in hospital having her induction. Those are moments that you don't expect to share with strangers, but actually I believe that some of the people that I've met through this group will be a part of my life for a long time. I just felt so relaxed. I felt so in control. I felt like I really knew my body. I knew what was right. So I was in labor and I didn't even realize because it was a pain-free labor pretty much. I was remembering, all those little tidbits of information that the sisters told me about not pushing too hard and, really feeling the baby come down by itself, and trying to keep your environment calm. When you've had a long night or you're thinking, why is the baby feeling like this? You can just go and you've got all these years of experience from all the women in the group to know everything you're experiencing is normal and every baby is really different. Of course, you can read books. Of course, you can speak to family members, but there's something about getting advice from somebody who doesn't know you personally. So you know that nothing they tell you or nothing they advise you is about you individually. They're never going to say you're a bad mother. They're never going to pass judgment because there's a level of detachment, which means that any advice they give you is genuine and from you. Another key thing about approachable parenting is there aren't women or Muslim women, and I'm both. And when I see these other classes from other organizations, all I see is white women. And I'm like, well, how do I fit into that? How am I going to be advised when people don't believe in God in the same way that I do, or don't understand my faith, and thus don't understand when I say that I have to do this because Islam says I have to do this, or well, yes, I do this because that's part of my culture, that's part of my blackness, that's part of my Africanness.
I joined the prenatal pregnancy group when I was 7 weeks pregnant. I am currently 35 weeks pregnant, so we're almost there now. Although this is my third pregnancy, so I feel a little bit experienced in terms of what pregnancy entails for me. I have felt that the prenatal pregnancy group has been absolutely invaluable, actually, just to have such wonderful midwives like Jo and Angela and all the other women who monitor and support the group. They're at my fingertips to ask any question I want, however trivial and silly it may seem. I honestly feel so lucky to have this group on my phone. Whenever I've got any questions or anything I'm worried about, I know I can ask the question there and it'll be completely non-judgmental. Really, thank you very much. And I'm looking forward to joining the postnatal group once my little baby is born.
My name is Anna Mette, chartered physiotherapist, where I have been monitoring the prenatal and postnatal group on a daily basis together with midwife Joe and Angela, as well as the approachable parenting team. For some reason, they hold back and they don't share what they're experiencing with anyone. So they don't feel that they're having a little bit of mistrust in the system, or they don't feel as if they can go anywhere and get the help that they need. Yeah, so they will rather post it in the group. And that's where the midwives and myself has trying to be very quick to respond to these messages and to encourage the women and empower them to really go and seek medical help. But it has been a real joy being part of this multidisciplinary team, and it has been a real joy seeing all these women in the group coming together and supporting each other emotionally and mentally and spiritually in so many different ways, and just having that beautiful community. And it has been a real joy to witness that. Yeah, so it has been a great, great blessing.
So then this is our last little slide about let our children be the coolness of our eyes, which comes from the Quran.
That's wonderful. Thank you very much. That's fabulous. I think what is fabulous is we haven't just had a twosome, we've had the mothers and your physio joining us to sort of talk about the effect of your program and the whole thing. And it's amazing how much you're doing and the impact of it in supporting women and their families are fabulous. And we are right at the bit of the time, so
sorry about that.
I think no I think if there's any questions, they'll come through on the live feed and you might want to answer them, but I think people are probably just stunned on having really the impact of the work that you've done, because that's a huge amount. And I mean, you make it sound very straightforward and we set this up and I know that there's more to it than that. There's a lot of work, and there's a lot of work in administering and making sure it all runs smoothly, which again you make look very easy. And the testament to that is all those women giving the feedback and saying how fabulous it was and how they feel much more confident and their fears have been taken care of. So thank you so much for sharing that work with us. I hope we'll hear from you again anyway. This is not finished, I have to say, but I'm very aware of the time.